Hello and welcome to the most hated show in the black corner of YouTube. I am your host, the whiteologist, Mr. Blows Your Minds, and this is Black Minds News Report. Black Minds News is to report, articulate, transmit, communicate, insinuate, develop, investigate, decode, unveil, spread the news, whether by news, video, website, or quotes from publications. As I articulate this information, I said the creator of the universe be here, heart, soul, mind, and spirit. Because why? The truth don't need no partner. As a descendant of the greatest people who created this land that we call the United States, we, the BADOS, Black American descendant of slaves, we to today's children, offspring, and present generation, we give honor to our ancestors. You know what my motto of my show is? I'm never gonna tell you what I heard. I'm only gonna tell you what I know. Today's date is April 23rd, 2020. Black Minds News is back after taking a little time off to handle some business. We are back again, once again. I want to thank each and every one of you for clicking. And, some news that I see dealing with, we're in a pandemic. Some people feel like the pandemic is clearing up. And then they got your penicillin, right? It's showing some signs of relief. But I came across an article that is talking about the tests that a lot of our people take or took. The question becomes, if this information that I'm about to show you, if it's real, and some of the things that I have done in previous shows, then the question becomes, when say things were padded, well, after you see this, maybe it'll leave a question mark in your head. So again, stay tuned as we get into this broadcast. Hey, how's y'all doing, everybody? Again, this is your host, Mr. Blows Your Minds, and welcome to Black Minds News Report. First and foremost, I'm going to say what's good to my fam, my subscribers. What's good, family? And new ones. Welcome to the most hated show on the black corner of the internet. Thank you for subscribing and being a new participant to the Black Minds News family. And those who have been patiently awaiting, I thank you kindly. You know, Mr. Blow Your Mind always got something going, but I don't forget about you. But if something comes along, I will break what I got to do and get in and do what I got to do. Passerbys, if you happen to just pass by, this is the most hated show on the black corner of the internet. We always got a grand opening. Go down the aisle, see some things that you might like. If you happen to hit something that make you feel some kind of way, remember the motto of my show is the truth don't need no partner. Now, as I was saying, as we're getting into the intro of the show, I came across some information, and this information is hot off the press. Right? This is really right hot off the press. And, there's been some speculations, right? There's been some speculations. And due to our history, would it not be a normal assessment for people who have endured what we have as BADOS in this land to question when things arises? some people say, well, when situations like this, you have people who are just trying to figure out conspiracy theories and try to assess that and not look at the validity of what's happening. Again, we're not here to say that whether something is not real or not. But based on our duration of schemes and machinations by individuals and peoples and systems, it would only be normal for a normal thinking person to just say, well, something's out of place here, right? Say if it smells a little funny, there might be something funny to it. Now, this information is not to discourage, it's not to say, to put doubt, but it's just information that's out there. It's public information. So it being public information, and then we are, as a news outlet, part of the black media or social media of this day. And I seen this, and then I have some ideas about some other things I want to play behind it. And there was another article that kind of ties into it. And so let me show you, I'm going to kind of take you back a little bit how the intros who've been around, they used to come on. Well, I'm going to start just to show you this particular part in that form of fashion, because I got some ideas about some things I want to try to do, but I'm going to do it from this perspective, starting off. And just kind of, listen to what's being said. And just, people always say, black people, very suspicious. We have to be. Using our predicament, you would be too. Now, I know there's different segments of us who look at situations and say that everybody's not in the same boat, and that is true. Financially, situationally, if that's a word, and every other lead, right? So let me go ahead, start off with this here, and I'll come back afterwards and we'll talk about that, what you just seen, right? So we about ready to get into that? You ready to do that? Okay, so go ahead, click that up, and let's get ready to do this.
So as we start to see the introduction of in-home testing for the coronavirus, we're also learning more about mistakes made at the CDC. According to a new report by the Washington Post, there were issues with cross-contamination. So we're going to speak to the reporter who looked into this. His name is David Willman. He took a closer look at this. David, you're an investigative reporter for the Washington Post. This is particularly disturbing because I think when many people think about the CDC, it's kind of like the gold standard when it comes to research and advice on diseases. So first off, just tell us exactly what the cross-contamination was, what the misstep was, and the effect.
Yes, good morning. Good to be with you. The getting reliable tests out to the hospitals, the clinicians, to the public health labs around this country was delayed. And the big unanswered question was, what was the cause of the original delay? And what we've reported is that there was a violation of sound manufacturing practices at the CDC in Atlanta that resulted in contamination of the COVID-19 test kits. And those kits then went out to public health laboratories around the country, and false positive results immediately showed up in those laboratories. Those results were reported back to the CDC, and the CDC took quite a long time to get on top of what was causing the problem and to remove the component of the test kit in which the false positive results had repeatedly emerged.
So, can you walk us through the timeline of testing in the United States?
Sure, I'll give it a whack. The key first date, I think, is January 12th of this year. That's when the Chinese medical authorities made public the genetic sequence for this virus. And once that genetic sequence was made public, it's sort of analogous to a bunch of track athletes down in their blocks ready to fire. And so the scientists at the CDC, at other labs around the world, many of them with sponsorship from the World Health Organization, set about using that sequence to develop a DNA test that could reliably assess whether a person was infected or not infected with the virus. That's the first stage. From there, the test kits started rolling out around the world. The first testing was done within days of January 12th. And the CDC, in fact, accurately confirmed a diagnosis of the first United States patient on the weekend of roughly January 18th. And thereafter, there was no problem with the reliability of that test. It was thereafter, as we've reported in the Washington Post, that a second batch of kits was sent actually to the first wave of public health laboratories around the U.S. And it's within that batch of kits that the contamination had occurred at the CDC.
So your reporting left me with so many questions. I'm sure for you too. Two of them is, why did the CDC violate their own guidelines in terms of how you manufacture these drugs? This test. But also, the biggie really is, once they realized that there was a problem with the test, it took them, according to your reporting, a whole month before they rectified it. Why did it take so long?
Those are excellent questions, Anne-Marie, and we don't yet have, I think, complete answers, anything close to complete answers to those things. Obviously, I think we have to assume that the CDC is not deliberately making mistakes or deliberately introducing contamination. These are highly sensitive processes in which, if everything isn't done exactly according to protocol, you can have a mistake. But as we all know, this saga of unreliable tests went on for weeks and weeks, and sort of the soundbite from the CDC in real time was, well, some of the state labs are having difficulties, they're having quote-unquote inconclusive results, we're doing everything we can to help them straighten out the problems. The fact that it went on for weeks and weeks while this virus took a hold in this country those are questions that are going to be pursued, I'm sure, for many months to come.
You know, David, I hear the president, when he steps up to that podium every day to do those, what are sort of becoming political rallies now, talking about the millions and millions and millions of tests that are being done in the United States. But according to the Johns Hopkins Coronavirus Resource Center, there have been 4.1 million tests conducted in the U.S. so far since we began testing. The U.S. is still just testing a fraction of the total population of the 330 million plus Americans. So how clear is it that the delays hindered scalability of testing across the U.S.?
Well, we know that the original delays inhibited the CDC and the public health authorities around the country ability to detect whether the virus was landing here in the United States and to what magnitude it was spreading through human-to-human contact. And that was huge from an original standpoint. But you're putting your finger on another aspect of the testing deficit, and that is the lack of what is called high-throughput testing capability. In other words, the CDC, even if there weren't problems, was not positioned technologically, nor were most of these public health labs, to conduct the volume of, let's say, per 24-hour cycle testing that you would ideally want. The commercial providers, such as LabCorp, Quest, they have that capability. And I think we as a country were very slow in integrating reliable test kits with the high throughput capability, and the tail to that deficit is being felt to this day.
David, you mentioned that the error resulted in false positives, but in reading your report, it seems that the component where the cross contamination occurred wouldn't necessarily, I guess there was false positives, but not false negatives, I presume. Has the CDC responded? Have they clarified? Have they explained? Have they confirmed your reporting?
Well, I'll take it in sequence. The CDC said in real time, as the first problems began emerging, that they had confidence in their test design. What distinguished the CDC's test from the test that the WHO is sponsoring is that the CDC test had 3 components, and 2 of the components were specifically and exclusively targeted toward the COVID-19 strain of the virus. The CDC's unique 3rd component, which is called by many a pan-coronavirus component, looked for a larger variety of coronaviruses, and we're left to assume that the designers of the CDC test thought that that would be a prudent thing to do, perhaps to improve the specificity power of the CDC test. The unfortunate coincidence is that the contamination happened in that 3rd component. That's where the false positives occurred. So the question was raised, I think, in real time, and certainly we haven't gotten an entirely satisfactory answer to that now. Why did it take the CDC so long to jettison that 3rd component, which the CDC ultimately, as of early March, late February and early March, acknowledged wasn't necessary to reliably detect whether or not a person was infected with COVID-19. So we need answers to that question. And Anne-Marie, you'll have to perhaps refresh the rest of your question for me if you want.
I actually think that you answered. Well, I wanted to know if the CDC responded directly to your reporting.
I've been in touch with the CDC, and they say that they are still seeking to come up with a lot of more explanations for what happened, and we're waiting to hear back for those additional answers. Their position has pretty consistently been that the CDC, they don't want to get into discussing a lot of what happened over the timeline until the U.S. Department of Health and Human Services investigation is completed. And we'll just have to wait and see how that process unfolds.
Hey, David, really great reporting. Thank you so much for joining us.
Thank you so much.
All right, so we are back, right? So, cross-contamination by CDC test kits is what they're saying, right? I don't know if any of y'all had heard about that, but as you heard in that video there was a reporter who found this information and has brought the light to it. But as I did some research, I found that it wasn't just only here, right? So we see cross-contamination. Now, contamination would be corruption in this test, right? Pollution in this test. Befoulment in this test. It's defilement in this test. It's infection in this test. It's poisoning in this test. Contagion in this test. Specificity in this test. What about defilement? I said defilement, right? Adulterating or adulterating. What about degradation? What about debauchement? What about foulness and impurity and filthiness and depravity? And I could go down and down and down with that, right? So I don't know, maybe you heard, maybe you didn't hear about that, right? So, that should raise a red flag in anybody's mind to hear that the word it kept using to see if somebody was positive for COVID-19 was the test. The test is the one that really determined. But we also seen as time went on that they were saying that the doctors could make the call on their own, right? Like they could determine based on the symptoms and could label somebody with it. Now we understand how that got into the conversation now, right? Or how that became the byword, right? And then those who are avid watchers of the show, remember that I showed the video that showed the woman who read the verbatim as into how doctors were to label according to the 3 categories, which fit everything that had any symptoms, and it had not to be that. Now you see how they got there, because they didn't want the public to know that they had faulty tests that they had administered to the states. And so, yeah. Some of you right now can feel what you're feeling, right? I can feel what you're feeling, right? All right, because think about that. There's been a lot of people who probably were classified as having COVID-19 and didn't have no COVID-19 at all, right? Didn't have COVID-19, right? And were told they were positive, right? Well, you heard in the conversation that they were talking about false positive results. So you have a faulty test. So it really is not determining whether you really got it or don't have it based on the faultiness of the test. So certain people might have been diagnosed with COVID. So let's just say, again, if pieces of this puzzle keep falling out, aren't you supposed to have some kind of questionability as to, like, wait a minute, what is that? Right? You see something that just don't fit in your normal routine, something a little out of place, like say you went on vacation, right? Say you went on vacation. And, the excitement and getting ready, getting all this, your luggage and all that stuff, and then preparation, then you go. But when you leave, don't you take a mind's eye picture of how everything is, right? You know where everything is. It's kind of like saying, for instance, I guess I'm doing 2 in 1, right? It's kind of like saying if somebody broke in your house and there's no lights. You can maneuver around in your house because you know where everything is. The person who comes in, unless they're familiar or, somebody know who you is and been there, can move like you move. But we're just saying somebody who has no knowledge of it, moving around will run into things. So I'm saying the mind's eye picture when you went on vacation is, everything how it's in its place. And then you come back and let's say something, when you come back, you notice something out of place, something missing, right? Well, that's how that is, right? Something's out of place here. He's saying faulty tests. We're hearing people getting kickbacks, 13,000. We're hearing 39,000. We're hearing you can, write the death certificate according to how you interpret it, right? So a lot of this leaves something to ponder over as to what's going on here, right? And so here it is, you thinking reliable tests, right? The way that they program us. You see a white coat and a stethoscope. Validation, this is a doctor. You see a police officer with a badge and a gun in a squad car, automatically a police officer, right? Uniforms and, the whole programming mechanism. So when somebody say test, you believe taking the test is going to be having no bias in it, that everybody who's taking the test is equivalent and equal. But you find out, like, SAT, ACTs and all that, they culturally biased is what they say, right? So these tests here seem to be biased in a way that is going to give somebody a reading that is going to alter their whole life. Let me say that again. Somebody can get a faulty test reading that is going to alter and change their whole life. And we're talking about an organization whose whole premise of its existence is, say, CDC, right? Disease control, right? You would think that that's about prevention, right? So that means there's a certain standard and policies and procedures that they must follow in order to get things right, because in their business, it can be life and death, right? That's life and death if they're not precise about how they're doing stuff. And so reliable testing means being accredited, being what the other word they use is, they say, let's say, for instance, what they teach us as being in society in this country. They use terms like, okay, CDC, right? When you hear CDC, when you say WHO, the WHO, right? The FDA, right? The AMA, right? When you hear somebody who's a professional, somebody who's certified, right? When you hear those terms, automatically they have an authoritative position that considered to be in your mind wholesome, right? When you really think about it, that's how you know, okay, you trust them, right? But could that be a way to be a Trojan horse? See, when something is too trustworthy where you don't question it anymore, is this a good tactic for me to be able to slip in on you undetected? But it got detected because, again, as you hear Mr. Blow Your Mind when we're talking this show, in my intro is, the truth don't need no partner, right? The truth don't need no partner. And so a lie can never be truth. So somewhere in that lie, the truth is going to fall. Well, somewhere in the lie, the truth going to fall out, right? And so that's what it seems like here. So they're talking about false positive results. And it can go both ways. It could be a false negative result, right? So there's just a lot of questionable stuff as to what's really going on here. Matter of fact, since I'm thinking about it, let me give you this visual for those who might not have seen this. And think about this when we're talking about these false positive results. Think about this for a second. And again, my disclosure or disclaimer, anybody who should happen to have a family member who has succumbed, demise, passed away, died on this, Black Minds News, we give our condolences to you. But we do report news according to what is out here with a black commentary. So sometimes we may present things, again, as I say, when you go down the aisle, see some things that make you feel a certain kind of way. Remember, the motto of the show is, the truth don't need no partner. Well, this here is a visual to go along with what I'm talking about. And let's think about that, the test, and have a faulty test. And the end result can be, as I said, to people who succumb to it. And what could have been the results of that? So let me show you this for those who didn't see it. Check this out.
Mass graves for an unprecedented crisis, a scene more like a Middle Eastern war zone or the Ebola outbreak in West Africa. But this is America. Hart Island off New York City has housed unclaimed bodies for 150 years. Now it's taking coronavirus victims. The city's morgues are reaching breaking point. At this Brooklyn hospital, body after body, wheeled into a temporary morgue, a refrigerated truck.
We lose 2,753 lives on 9/11. We've lost over 7,000 lives to this crisis. That is so shocking and painful and breathtaking.
799 people lost their lives in the state yesterday. New outbreaks are still emerging. Cook County Jail in Chicago is now home to the largest local cluster in the country. This prisoner, lucky enough to be granted temporary release due to asthma.
It's just complete chaos. The detainees are losing their minds because they have less time to speak to their loved ones.
Others haven't been so fortunate. AB Weeks is fighting for their release, organising a mass protest around the prison.
This is basically a death trap right now. There is no such thing as social distancing when you're in jail.
The outbreak continues to cripple the economy. Another 6.6 million people lost their jobs last week, taking unemployment claims to almost 17 million since the crisis began. Australian Warwick Benson lost his bar job in Chicago last month.
Luckily, I had some good months and I saved a bit, so I could cover my rent and all that. But this could go on for a while now.
Despite social distancing, people are queuing for unemployment papers right across the country. Food banks are overwhelmed. In Los Angeles, the pouring rain not enough to dampen the crowds. It's still being described as an economic crisis, but it has the hallmarks of a depression. Catherine Diss, ABC News, Washington.
All right, so we back, right? So the mass graves that they were burying people. Now again, if they can't be certain as to if anybody really had COVID-19, and then giving them a death sentence by telling them that, let's say they came and maybe they had the flu, maybe they had just pneumonia, again, right? But you gave them a death sentence by telling them something, and somebody who might be weak of mind and heart, psychosomatically, lost their will maybe, right? And another way you can look at this too is the fact that the faulty tests also can mean, at least as I said, right, when they're talking about contamination, poison and contagion, septicity, defilement, pollution, I want to show y'all something else that I've seen too. I'm going to stay on the point that I'm talking about, but I want to show y'all something. I'll go to that after that. So, it said, according to what they're talking about here on this video that you've seen, that was on CBS, they said, well, there's the components in the test. There was 3 parts in it, and then there's 1 part in it that was faulty. It wasn't the entirety of the test. But in that component makes the difference whether you get a good reading or not, right? So, you know what I'm saying? All synchronicities work in cahoots so that you can get the results that you're seeking, right? At least that's the way I'm assuming, right? And so accordingly, this reporter said that this went back to January 12th. Now, those who watched the show over here that I did the video and gave you the timelines of when they were talking about the evacuees coming in around January 29th, actually as early as January 22nd. But as I've done more research over the time and looked at more things, I've come to realize that, if they're talking about January, and then they're talking about 1,600 people, 800 here, 5,000 here, right? Thousands more. And then they say by, late January, early February, they said just about in every state in the country has a person who has been tested as positive. So according to the person who was speaking in the interview there, he said January 12th, those up until that point, those tests were fine. Then he said then by January 18th, he left it to a batch. He said it was just a batch, right? So, we don't know whether it's a batch or do we know every, process that was made the test after that? Were they all contaminated? We don't know that. But we do know that according to the number they say of 825,000 cases that they say are positive and 45,000 deaths. We do know that according to what you have specified. And so, they said the genetic sequence was revealed in the test. And that's how they was able to determine. And come to find out that it's the CDC who violated its own guidelines in the process of making the procedures of how you make this. And he said that here it was in January, but they don't start getting into like late February, March, a month later before they're trying to even do anything about it. So those readings that they had in this infancy stage, was those numbers accurate? Maybe now we can understand why somebody was saying, well, going to be 100,000, 200,000 people are going to, and we're going to have this, because they had no idea, right? Obviously, they had no idea. And so you heard this person here, even though it's what he's finding, he still had the silver lining for the institution by, he said that he doesn't assume that the CDC didn't deliberately taint the test. He don't believe that. Now, again, it depends on what side of the spectrum you are on as, ethnicity in this land, right? Black people history and these institutions, the AMA, American Medical Association, right, and everything, all the others. Well, who was your test dummy? Who was your practice dummy? Right? How did you get your research that you got your research? And we've got another story that came out later as we go on more. Right? So, I always say there's no such thing as a conspiracy in this country. And more information has been coming out as into CDC, the WHO organization, Bill Gates. You even have, I seen somebody talk about earlier, talking about even the person who is the CEO now of YouTube. And they are tied in some way. So it's like, as this rabbit hole goes deeper, as more stuff gets revealed, matter of fact, even talking about the YouTube part, they even getting to the point again, after they done revamped again, that now they are saying that certain advice that people are given dealing with the coronavirus, as into whether you want to use vitamins or using some kind of herbs, will be considered to get your channel and video taken down. Anything that goes against the prescriptions and guidelines of an organization or institution who seems to can't get right their damn self. Right? So somebody giving you bad advice, right? Once you find out that this person is not trustworthy in what they say, then how much credibility do they really got with you anyway? Should have none, right? You have no credibility with you. And so they said that this delay, because there ended up being a delay, right? There was a delay that happened. But before I get into this delay, I want to show you this here, this story. Because see, this is just one part. And the part that they talking about, I don't think is the part that's really, they're not really trying to tell a real truth here. That I guess they're trying to get this story out to be the story so that they don't have to really deal with what I'm about to show you, this article that came up. Let me see if I got, okay, I got that ready. We're going to do this. So I want you to see this article here that also came up. And I'm going to read this to you. Check this out, and we shall be right back after this. Check this out. CDC's failed coronavirus tests were tainted with coronavirus. Feds confirm. You know I'm going to say that again. CDC's failed coronavirus tests were tainted with coronavirus. Feds confirm. A federal investigation found CDC researchers not following protocol. This story is coming out Ars Technica by Beth Moe, April the 20th, 2020. And this is how this reads. As the new coronavirus took root across America, the United States Center for Disease Control and Prevention sent states tainted test kits in early February. They were themselves seeded with the virus, federal officials have confirmed. The contamination made the test uninterpretable, and because testing is crucial for containment efforts, it lost the country invaluable time to get ahead of the advancing pandemic. The CDC had been vague about what went wrong with the tests, initially only saying that's a problem in the manufacture of one of the reagents had led to the failure. Subsequent reporting suggests that the problem was with a negative control. That is, a part of the test meant to be free of any trace of the coronavirus as a critical reference for confirming that the test was working properly overall. Now, according to the investigation results reported by the New York Times, federal officials confirmed that sloppy laboratory practices at the 2 of 3 CDC labs involved in the test creation led to contamination of the tests and their uninterpretable results. Just tragic. Shortly after the problem became apparent, in early February, the Food and Drug Administration sent Timothy Stenzel, chief of the Vitro Diagnostic and Radiology Health, to the CDC to investigate what was going wrong. According to the Times, he found a lack of coordination and inexperience in commercial manufacturing. Problems that led to the contamination included researchers coming and going from labs working on the test kits without changing their coats, and researchers sharing lab space to both assemble test components and handle sample containing the coronavirus. The CDC said in a statement Saturday to the Times that the agency did not manufacture its tests consistent with its own protocols, though the CDC appeared reluctant to admit contamination was at the root of the problem. The Times noted that in a separate statement that CDC seemed to acknowledge such problems, saying the agency has since implemented enhanced quality control to address the issues and will be assessing the issues moving forward. After the CDC first sent its test kit to states in early February, it took the agency around a month to fix the problem. By then, the virus had invaded many communities unimpeded, and any chance that the United States had it containing its spread had virtually vanished. By mid-March, many states turned to mitigation efforts such as social distancing to try to blunt rather than prevent the life-threatening, healthcare overwhelming effects of COVID-19. It was just tragic, Scott Becker, executive director of the Association of Public Health Laboratories, told the Times. All that time when we were sitting there waiting, really felt like here we were at one of the most crucial junctures in public health history, and the biggest tool in our toolbox was missing. As of the morning of April 20th, the United States had confirmed more than 760,000 cases of COVID-19 and more than 40,700 deaths. The numbers are expected to be underestimated due to the slow and still limited amount of testing. All right, so I'm not sure what happened on there. Got some technical difficulties going on here. Look like trying to do what they do in the background, but we're going to do what we do regardless, right? So anyway, so that was the article on the CDC, right? And talking about how the failed coronavirus tests were tainted with coronavirus, right? It's kind of like thinking about getting a vaccine, right? Don't they give you some of what they say they're trying to prevent you from getting so that your body can build up an immune or antibodies so that it's not something foreign for the first time that the body is trying to react to it, right? So, you know, accordingly, that was an African tradition that the Africans taught them how to deal with it, I think going back to smallpox, right? But according to, as you heard in this article here, the federal investigation found that the CDC researchers were not following protocols. Kind of same thing there, right? But in the video, when you heard the news story there, he didn't say anything. He didn't say anything about tainted with coronavirus. He was just saying certain aspects of the component of how it operates that would not synchronize to give you the accurate read. That's what he was trying to make it assume, right? That's the way he was trying to make it come across. And so you see here that this story coming out of this Ars Technica, and they said that the CDC sent state tainted test kits in early February, seeded with the virus. So when you hear that, does that sound like somebody doing something diabolical, or was that an accident? In order for a test to read, so based on what this is saying here, now again, this is the reports in the article that they're giving. We're just making an assessment off of what they're saying. Then, remember I did a video talking about how did the coronavirus, which is COVID-19, I don't even know why they even saying coronavirus when they say coronavirus is, you know, from animals, right? But from transition from human to human is COVID. So why is anybody still even talking about coronavirus, right? So again, you know, it's always trying to get you turning left and turning right. But this kind of reminds of the history when you think about in this country, when they told you that how they got rid of the Indians. So they put smallpox in the blankets and gave it to the Indians. Let me say that again. It's said in this country in the history that the colonizers came on the land to steal the land, gave as a helping to the Indians. I don't know why the Indians would be needing blankets, right? They were already here. Just think about that too. Indians are already here for we don't know how long. And again, when we say Indians, don't necessarily mean the ones you see on the reservations, right? But we're just going to say they had been here. So that's like we being here. We as BADOS, been here for 400-500 years. Can somebody come from somewhere else and offer you a gift that you didn't already have in preparation? Now, maybe they just gave you something that is new, right? There's nothing wrong with a gift. But the way they make that sound is if you gave them the blanket because they didn't have no blankets, and like the first time you offer them something that they had nothing of. And in that, you gave them would be considered biological weapon. Smallpox. Matter of fact, in that European history, isn't that the first biological weapon used to be taking let's say when the plague, and when they was having war, they would take somebody who had the plague and take them and throw them into their water stream and their water system, pollute their water and then tear up that whole town or city or whoever was this carcass that they had that was infected. So that was like one of the first biological weapons used by them, right? And so as history keeps repeating itself, then here's a story that falls out for the truth for us to hear and see that this story here says that it was seeded with the virus. So with that being said, one may have to kind of look at this and say, well, wait a minute. As Mr. Blow Your Mind did the story talking about how did the coronavirus get into the hood, right? Because now they're writing the way they're writing the stories. Now they're trying to say, well, a lot of black people being essential workers, they were, but how that, wait a minute. The people who were coming from Wuhan, if we're not seeing the numbers showing that Asian people are being highly contracted with the COVID-19, the numbers are very low, death even lower, right? If they're not getting it, and we would assume that a person who's Asia would be coming from China, then they would be a carrier if they come between the times of November through January coming into the United States. The high probability of that would be more than a high positive. Now, the next people would be white folks, because white folks go everywhere in everybody's business, right? And so, do he got business in China? Yes, he do. So he would be the next person that would be. Then we would say, other people accordingly, right? Now, I'm not going to sit here and tell you that black Americans could not be in Wuhan, China. Because again, black people work in all kind of capacities of professions. So according to what I've read and then what I have displayed for those who watch, we've seen that the people who they were evacuating were who? People who were part of the system. System workers, state government people. It was not ordinary, regular people. So, with all that being said, and then I have done, and I will do the video as time go on, because again, they got the face of COVID to look like us, but when you look at these numbers, you're going to realize that that face ain't BADOS. Okay? But anyway, that's for another topic for another time. So somebody to stealthily get in, well, you would not detect that if you're taking the test. You're not thinking that somebody's, doing that to you. Again, if you're not very aware and apprehensive about everything, your guard is down. But according to this article, somebody decided this was a grandiose idea and a way to get it in. And according that the contamination made by these tests were uninterpretable. Right? And accordingly, the testing is made for crucial containment in the efforts and how you do what? How you're going to be able to deal with the situation. And so it says that the CDC had been vague about what went wrong with the tests. They don't really want to disclose what went wrong with the test. Now, you heard the writer that disclosed, he said the 3 components, but in this article, they're saying that they didn't want to disclose. They said, well, initially only saying that a problem is in the manufacturing of one of the reagents that led to the failure, right? And suggest that the problem was with a negative control. And part of the test meant to be free from any trace of the coronavirus as a critical reference to confirming that the test was working properly overall. It wasn't supposed to have coronavirus in it. How did coronavirus get in it anyway? Right? Matter of fact, since that being said, that let me show you something I had seen. Now they supposedly debunked what I'm about to show you, right? They supposedly had debunked this. But in this day and age and right now with everything that's happening, and you're seeing that the powers of be are trying to quell what they call the truthers, right? Those who, media outlets as alternative news, different from the general news. And when you see that, that there are, I'll say, contradicting what you're saying and showing something to offset what you're doing, then that's kind of like the truth prevailing over the lie. And so what it means that you're disclosing or exposing somebody who don't want to be exposed. So let me show you something here that I had seen, right? It says the Pentagon confirms coronavirus accidentally got into the chemical supply chain. Spraying is suspended. Wait a minute. Say that again, Mr. Blows Your Mind. Pentagon confirms coronavirus accidentally got into chemtrail supply chain. Spraying is suspended. Now, that story there came up, right? Is it true? Well, they debunked it and said, oh, that was some conspiracy theory. That's not true, right? And if that be the case, then we should be hearing more news about them going after these people who put in these kind of false stories like that, selling to the people, and then saying that the Pentagon confirmed it. But I haven't seen no retraction on none of that yet. I just seen somebody put something saying it's been debunked as fake news. But anything this day right now is fake news. It's for those who have either a discerning eye, spiritual intuition, a solid foundation to be able to discern, the wheat from the chaff, as to what is real and what's not. So everything right now is a lot of manipulation, a lot of propaganda, and people are confused. And so a lot of people are trying to rely on people who they think that they can rely that their source and information, and if they're presenting it to you, now they may be, as Black Minds New do, I show you where I get the story from and the video from. So it's not just me saying some stuff like some people do. And again, everybody do what they do. That's their business. But I'm just saying, so when you've seen this story here again, right? Chemtrails, coronavirus and the chemtrails. So if that's, let's say, hypothetically is true, then at night when you're sleeping, that's why you can't keep the mask on all the time, because you got to ask yourself, wait a minute, you got the mask on all the time. Now, I understand if you're going to be in an enclosed environment, got to be close to somebody, just in case somebody sneeze or cough or something. You want to have something blocking, catching your own face, right? But just being outside, is the air contaminated? It makes you wonder, right? It just kind of makes you wonder, right? And so, what's real, what's not real, right? There's a lot of freezing going on over here, man. They don't really want you reading this stuff, right? So, Shirley says that they also, you got the CDC talking about this. It says, shortly after the problem became apparent in early February, Food and Drug Administration sent Timothy Stenzel. And he was supposed to went over there to the he's from the radiologist health to investigate the CDC, what was going on, right? And it goes on to the whole aspect of what they did. So, there's so much out here to the fact it's like, what's real and what's not real, right? There's like chemtrails, talking about the tests are tainted. You have people saying that doctors are writing due to get money and kickbacks. You got, mass graves, a powder field of people, but then they said that the numbers that they were stating may have been padded, and then now they're trying to take some of the numbers back and say that, well, not everybody who is considered to have been under COVID, we took some of those numbers back. How could it be so messy? Why is it so messy? I think about why is it so messy like that, right? If something ain't rotten in Denmark, right? Something ain't right, man. No matter what everybody trying to say and everything, trying to quell everybody from talking. But the truth don't need no partner. If whatever it is, if it's the fact, the truth, it's not going to waver. It's not going to move left nor right. It's going to always be straight. It's when it start hooking left and cutting and ducking and moving, you have to say, okay, well, what's going on here, right? Now to the fact, now think about this. They called in March 12th or 13th, where I showed y'all about the Donald Trump had the called a national emergency. We're April 23rd, and they're talking about opening back up. So we're talking about a month, a little more than a month later, 5 weeks later, open back up. So I have to say, well, maybe it was a failed assassination attempt, right? Maybe it was a failed assassination attempt. It didn't get the numbers that one want, but that's what somebody trying to say. Well, now the second one coming. Well, it's kind of like an earthquake, right? When an earthquake comes, does the second one be as big as the first one? Right? You know what I'm saying? Does the second one come as big as the first one? And now people say, oh, we're finding people dead, the convalescent homes, right? And people now coming in, they're testing it. Well, if you said people coming in testing and you talking about you got, 800,000 people tested, but then you had a lot of tainted tested, then how we know if all them numbers is exact in the fact what you saying? It's a mess, man. It's really just a mess. When you really look at this shit, it's like, what the fuck is really going on here, man? And we know what it really is, but just again, people just want us to be as stupid as they think we are. We're not stupid like that. We've been around y'all too damn long, right? We know how y'all get down. But you think we not smart enough to detect that. So, like I say, the truth don't need no partner. If it was legit like you say it is, it's going to move smoothly. Once you start getting bumps and people, saying this and the story don't match to this and this here and then, accident, something here, found out here, then you got to say, put it all together, you got to say it's false. Now, I'm not saying that the virus and people dying ain't because somebody actually is trying to do something to somebody. Whether it's because of what happened in one particular place, or is it just these things that are falling out? But again, some people are going to say this is false and fake news. It's out here. I didn't make it. It don't have my name in that I created this and I wrote this. This was somebody else writing. Right? So if it is what it's not what it said it is, then I guess you need to go get them and hold them accountable for out here causing panic. But how about this? So I seen this story too, right? I seen this story right here. And the end result was what it was, but check this out. Be right back. Man dies after being denied coronavirus tests at 3 emergency rooms because of racism. Family alleges. You know I'm going to say that again. Man dies after being denied coronavirus tests at 3 emergency rooms because of racism. Family alleges. This story is coming out of Yahoo News, April the 23rd, 2020, and this is how it reads. A man who died in Michigan was denied coronavirus testing at 3 different emergency rooms because he was black. His family has alleged. As state officials said, a medical bias may exist in COVID-19 testing. Gary Fowler, 56, was reportedly not tested for the novel virus at 3 Detroit area emergency rooms despite having many symptoms associated with the disease, according to his stepson, Keith Gambrell. He was begging for his life, but no one would help him at all, Mr. Gambrell said about his stepfather in an interview with CBS this morning. They just kept sending him away. He added, I honestly believe it was because my father was black. They didn't honestly take his symptoms serious enough to give him a test. Mr. Fowler later died at home. He reportedly wrote the words, heartbeat irregular, oxygen level low, on a piece of paper before he passed away. The family faced multiple severe coronavirus cases, including Mr. Fowler's father, who died from COVID-19 a day before his own death. Mr. Fowler's wife, Cheryl, was also sent to the hospital after developing symptoms and was put on a ventilator to assist with her breathing. Out of concern for his family amid the outbreak, Mr. Gamble called his cousin, Karen Whitsett, a state representative who happens to recently visit the White House to speak about surviving her own case of novel virus. Ms. Whitsett then managed to have the whole family tested, calling CBS sickens her that she had to use her title as a state lawmaker to get my family tested. The state launched a task force dedicated to investigating racial inequalities surrounding the coronavirus pandemic. Lieutenant Governor Garland Gilchrist, chair of the state task force, told the network his group would address the fact that there may indeed be medical bias present when it comes to testing. The lieutenant governor also said such a bias may exist in terms of who will even get a test, as well as in how treatment is administered. In announcing the launch of the new task force, Michigan Governor Gretchen Whitmer noted the coronavirus outbreak has taken a disproportionate toll on Michigan communities of color. I'm confident that this task force will help us identify the factors driving this disparity and to identify actions we can take to create a more equitable Michigan for everyone, the governor said. Each of the task force members will provide a unique perspective and play a vital part in identifying these barriers and ensuring all Michiganders have equal access to critical resources when they need them the most. All right, so we are back, right? So a man dies after being denied coronavirus test 3 times in emergency room because they said the family believed because of racism, right? Maybe they didn't want to give him the test because they knew. Based on what I just already showed you just now, maybe they didn't give him the test at the hospital because they knew that it was going to end up being positive. And the positive is the fact that, again, what we just read, and he had the symptoms, but they didn't want to do it. So, you know what I'm saying? So obviously there must have been some knowledge of this. Now, this is done April 22nd, right? Today the 23rd. This was yesterday the 22nd. So the other stories might be a little earlier, but look, they denied this man, black man, from getting help. And he had all the symptoms and everything, but for some odd reason, they didn't want to give him that test. And so they saying that it's medical bias, right? Gary Fowler, who was 56 years old, right? It was in Detroit, Michigan. Now, those numbers in Michigan are very high, right? And so it looks like that not just him, other people in his family had it. Matter of fact, that he had somebody in his family that had some pull and used her pull to get the rest of the family tested. So again, as I was talking earlier in the show, when I was talking about the evacuees and who were the personnel that is, isn't it ironic that this person here who is being denied, that's one particular part of the story. But then as the story goes down, it's talking about how they had somebody who they could get, who could use their pull to get them to get seen. See? So it's like, again, the people who are having it seem to have been the people who were part of the system. But how did this become the face of black folks? Then we have to see what they're talking about, these tests, and say, damn, maybe it was because they took the test. Because, again, in one of the shows that I had did, remember I showed you a video that we were already in a flu epidemic in this country. There were a lot of people just don't remember. We were just coming off, I should say, a pandemic, a flu that engulfed this whole country. They had said there was over 10 million people who had the flu, and that ran from 2019, let's say October 2019, and it ran all the way up to the first week of January. And it showed the map, the whole country had the flu. So we were still dealing with that, unbeknownst to a lot of people who probably didn't even know. And also I had showed in there, if everybody kind of remember, when they was talking about the kids could catch this N1H2, and, they were, trying to prevent them from dying. So we were dealing with a lot. This just like it was not common knowledge. So there's a possibility that a lot of people who were getting sick were already sick from the flu prior before then. Yes, we're not saying that the corona or the COVID-19 is flu, but when you went in there with symptoms of cough and, fever and all that, it could have been that. Then they tell you about these tests. Then you got other underlying issues as they want to keep trying to use as the reason why black folks get, because you got underlying, what you been had underlying issues. But tell me how does this virus get in where I live at? If you got me, again, secluded over in the corner, you got me redlined, you got, disenfranchised. The only way it could get in there is through somebody who working. And let's say that majority of the cities where it is a high population of black folks, the unemployment is higher than everywhere. So most of them ain't getting it from their job. But then we seen in that story that I just showed y'all in that news clip, let's just say, for instance, it talked about Chicago, and it talked about Cook County Jail having the highest concentrated contracted in the country. And remember, they was talking about just releasing them without testing. So maybe that was where that was coming from as well, right? So then you have to ask yourself, well, how did they get it in the jails like that? Who was in Wuhan that ended up getting locked up in jail? And then you get what I'm saying? How's all that happening? It's got to be the questions. I mean, how does something, again, you talking about January, and then it just everywhere. How is that possible if when you brought people in, and according to the story that you want to say, that we quarantined people off and we checked them, obviously you did not do what you said you did. And now I would have to say the reason why you didn't do it is because they, you know why. The numbers are going to reveal in time. So we see that Mr. Fowler's family, they say they believe that the hospital was saying that his symptoms wasn't serious enough. I like to probably think, and again, I'm just, hypotheticalizing the situation and saying because they knew what we're talking about here. Nobody there wanted to give the test because they knew the test was basically probably going to be a death sentence for you. So they were hoping that either you toughen it out, maybe somebody else go somewhere else and maybe they would do it, but they didn't want, somebody did not want the responsibility falling on them, right? Because everybody just wants to say, well, black people get it, black people. The question becomes, how do black people get something that was coming in damn Wuhan? Black people, because you got underlying health. Who else in this country don't got underlying health? Every white person got money? It's more white people, according to what they say statistically. There's got to be a way bigger portion of poor white folks than there is black folks. If black folks is 12, 13, 14% fluctuates all the damn time, never want to give it, and we are in the year supposed to be doing the damn census, and it's kind of funny that all this is happening too, but that's another story for another time. But with 14%, how do you want to say the percentage of black folks is poor? Are we going to say that there's at least 4% of black people who working and got jobs and, 4%, then the other percent going to be some children. So what percentage of the people who going to be poor? Right? So if you're people who are 67%, 60%, it's all 60% of you getting rich, all you got money. What portion of that is poor of that 60? So why everybody trying to say like black people are only poor people who got underlying issues in health, as if these other people who are poor, uneducated, kind of similar, but only thing is they get the protection for the complexion because they got white skin, but they ain't eating the stuff, or because a lot of them might have had taken when they were talking about going through the opioids, right? When all the opioid was going on, right? Who was all them, right? So now that this come along, that ain't tackling them. See, that's what everybody trying to make you see that that's not happening. But if you look at them numbers as I looked in them numbers, you're going to realize that you're not the face. But you have to be the face because somebody else can't take it. If they the face, well, you're always the bad guy. So it's nothing new to you. We have to save face, right? So anyway, that's what I think that happened in the situation here. They kind of knew already. They knew, just like I just read to you about them tests. They already knew. But somebody there did not want to administer to you because they knew. Say, no, man, I don't want to do that, man. It seems like every time we do these tests, and then there was some people say, man, every time we put these people under these ventilators, they dying. So it's something with this and that there, right? Well, how about this? Let me go and do this then, right? Because again, everybody say, black people, you're whining, bitching, moaning, crying all the damn time. Just go and take the test like everybody else gonna take the test, right? Well, let me see this story that I seen here. I'll do this and be right back. Check this out. Tuskegee always looms in our minds. Some fear black Americans, hardest hit by coronavirus, may not get vaccine. You know I'm going to say that again. Tuskegee always looms in our minds. Some fear black Americans, hardest hit by coronavirus, may not get vaccine. This story is coming out of USA Today. Story was done April the 20th, 2020 by Jane O'Donnell. And this is what it says under the caption of that picture. Pressure to create a coronavirus vaccine is increasing by the day. But for a safe vaccine to enter the market, it takes time. This is how this story reads. David Graham is a nurse practitioner who spends his days and nights treating COVID or coronavirus patients. He's a 41-year-old black man who learned in high school how doctors failed to treat hundreds of black men in a federal study for their syphilis. So he declined to trust the government to get a vaccine for the pandemic right. African Americans who are being infected and killed by COVID-19 at a much higher rate than whites are 40% less likely to get flu shots. Study out last year showed. Some fear they will be reluctant to get the coronavirus vaccine when one is released. A historical distrust of the healthcare system, which has far fewer physicians of color and a record of discrimination and mistreatment, get much of the blame, experts say. For African Americans of a certain age group, Tuskegee always looms in our minds, Graham said. In 1997, President Bill Clinton issued a formal apology for the United States Public Health Service study that started in 1932. Men who were mostly poor and illiterate sharecroppers were enrolled in a study of syphilis. Hundreds were not given penicillin when it was found to be a cure. Dozens of men died and countless others were infected. Black Americans are dying of COVID-19, the disease caused by the coronavirus, at a much higher rate compared with other Americans in some major cities. Of the 512 coronavirus-related deaths in Louisiana, for example, about 360 or 70% were African Americans, even though blacks comprise less than a third of the state's population. Most federal officials in states are not keeping track or releasing racial data on COVID-19 victims. The racial cited for the higher death toll includes higher rates of chronic illness, especially heart disease and diabetes, higher rates of exposures to infected people in jobs that require face-to-face contact. Fighting fears with vaccine facts. The resistance to vaccine is unwarranted, said Dr. Garth Graham, Vice President of Community Health and Impacts at CVS Health. Citing Centers for Disease Control and Prevention data, he noted the flu vaccine prevents millions of illnesses and flu-related doctor's visits and complications each year. Another major study, he said, showed the flu vaccine can significantly reduce a child's risk of dying from flu. Children with underlying high-risk medical conditions saw their risk reduced by half and the risk of death dropped by nearly 2/3 for healthy children. Given such strong arguments for vaccination, Graham said racial disparities in flu vaccines can be lessened, if not eliminated. History of Tuskeegee notwithstanding, you should not assume the resistance to vaccine because it could be a lack of appropriate outreach, Graham said. Are we designing and pushing the campaign enough so we're reaching all communities? When he was an investigator and chief of health services research at the University of Florida, Graham said he didn't find much resistance to vaccines when he explained the risk and benefits. Disparities are often due to inappropriate and ineffective outreach, said Graham, former Deputy Assistant Secretary at the Department of Health and Human Services. Nurse practitioner David Graham, who is unrelated to Garth Graham, still worries. He said flu vaccines have taken decades of trials and error. Many people still get the flu. The speed and financial interest involved in the race for a coronavirus vaccine concerns him. He hopes it isn't made mandatory when kids get back to school. Building trust. Epidemiologist Suma Vutaputuri, a research scientist for Kaiser Permanente Mid-Atlantic region, studied what factors lead to the disparity between African Americans and whites getting flu shots. Her study last year in the medical journal, PLOS One, found African American in health systems were 40% less likely to receive a flu shot than white members despite having access to health care and no out-of-pocket costs. That's for a health system with more doctors of color than many others and a study population of higher socioeconomic levels, and indicating there may not be as much of a problem with distrust. Bupaturi said she expects the same disparity would not exist with coronavirus vaccination because of the media attention and the seriousness of the pandemic. I suggest that if the vaccination is offered equitably, the disparity would not be as great, she said. More African Americans are likely to get the coronavirus vaccine if adverse effects are reduced, said Dr. George Benjamin, Executive Director of the American Public Health Association and a former Maryland and D.C. Health Commissioner. That will be aided if African Americans participate in the research for drugs and vaccines, he said. Less than 5% of the nation's or National Institutes of Health-funded respiratory research included racial or ethnic minorities, according to a study in 2015 in the American Journal of Respiratory Critical Care Medicine. Similar disparities exist for cancer, heart disease, and diabetes research, even though these diseases affect people of color at far higher rates. Vaccines are overall safe and effective, Benjamin said. Even though a vaccine for coronavirus will be new, he hopes research protocols for clinical trials will have enough women, Hispanic, and African Americans, so there are no untoward effects in those populations. We always have to be on the watch for research misconduct, but there's much less chance today of the significant abuses that occurs with Tuskegee, Benjamin said. United States have higher standards for vaccine approval and oversight, he said. What is most important is for people of all races to have equal access to vaccines, since we're not going to be or go back to a normally until we have an effective vaccine, Benjamin said. All right, so Tuskegee study of untreated syphilis in Negro male was a clinical study conducted between 1932 and 1972 by the United States Public Health Service. The purpose of this study was to observe the natural history of untreated syphilis. The African American men in the study were only told they were receiving free health care from the federal government of the United States. The experiment was conducted and documented for 40 years. Public Health Service started working on this study in 1932 in collaboration with Tuskegee University, a historical black college in Alabama. Investigators enrolled in the study a total of 600 impoverished African American sharecroppers from Macon County, Alabama. Of these men, 399 had syphilis and 201 who participated in the study were enrolled as control. The men were given free medical care, meals, and free burial insurance. The men were told that the study was only going to last 6 months, but it actually lasted 40 years. After funding for treatment was lost, the study was continued without informing the men that they would never be treated. None of the men were told that they had disease, and none were treated with the penicillin even after the antibiotics was proven to successfully treat syphilis. According to the Centers for Disease Control and Prevention, the men were told that they were being treated for bad blood, a colloquialism that describes various conditions such as syphilis, anemia, and fatigue. Bad blood, specifically the collection of illness, the term included, was a leading cause of death within the Southern African American community. The 40-year Tuskegee study of untreated syphilis in the Negro male study was a major violation of ethical standards. Researchers not only failed to treat patients appropriately after the 1940s, validation of penicillin was found as an effective cure for the disease that they were studying. The revelation in 1972 of the study failure by a whistleblower, Peter Buxton, led to major changes in U.S. law and regulation of the protection of participants in clinical studies. Now studies require informed consent, communication of diagnosis, and the accurate reporting of test results. By 1947, penicillin had become the standard treatment for syphilis. Choices available to the doctors involved in the study might have included treating all syphilitic subjects and closing the study, or splitting off a control group for testing with penicillin. Instead, the Tuskegee scientists continued the study without treating any participants. They withheld penicillin and information about it from the patients. In addition, scientists prevented participants from accessing syphilis treatment programs available to other residents in the area. The study continued under numerous public health service supervisors until 1972, when a leak to the press resulted in its termination on November 16th of that year. The victims of the study, all African Americans, included numerous men who died of syphilis, 40 wives who contracted the disease, 19 children born with congenital syphilis. Tuskegee syphilis study cited arguably the most infamous biomedical research study in the United States history, led to the 1979 Belmont Report and to the establishment of the Office for Human Research Protections. It also led to federal laws and regulations requiring institutional review boards for the protection of human subjects and studies involving them. The OHRP manages this responsibility within the United States Department of Health and Human Services. On May 16, 1997, Bill Clinton formally apologized on behalf of the United States victims of the experiment.
What was done cannot be undone, but we can end the silence. We can stop turning our heads away. We can look at you in the eye and finally say, on behalf of the American people, what the United States government did was shameful, and I am sorry.
Damage done by the Tuskegee study is much deeper than the wounds.
For only you, Mr. Shaw, the others who are here, the family members who are with us in Tuskegee, only you have the power to forgive. Your presence here shows us that you have chosen a better path than your government did so long ago. You have not withheld the power to forgive. Mr. Shaw, the others who are here, it is against everything our country stands for, and what we must stand against is
All right, we are back, right? So, Tuskegee always looms in our minds, don't it, right? This is the part that is always in BADOS's mind, because, again, it went from 1932 to 1970, 72, 40 years. So we are to sit here and believe that for 40 years, it was only in this one particular place that this study was taking place. Is that what they want us to believe? In the day and age and now that we know and looking in hindsight. And so a lot of people downplay this story. A lot of people just say, well, it wasn't all of them, according to, as I read to you, the 399. But if you're talking about 40 years, it didn't specify of the 399 what age group they were. They just said they were all poor sharecroppers. Didn't specify age. And, withheld. And he said 201 was kind of like a placebo. You don't have it, but you're going to be in the study and it's kind of part of the control, right? And so men who were ill, but you had a cure, but you didn't give it to them. You wanted to see how this worked, right? It's kind of like, how do you test? Matter of fact, I remember reading a book called The Plutonium Files. Anybody read that before? Plutonium Files. And when they was there to create those bombs that they dropped on Hiroshima and Nagasaki, right? Well, they also did a test bomb, I think, in Albuquerque, New Mexico, I think it was, if I'm not mistaken, right? Right? Did a bomb over there, right? But accordingly, they had one bomb supposed to go to Germany, the other one supposed to go to Japan, but Japan got both of them. We're going to do family, right? We're going to test this out. Well, we tested out on the Mexico. Okay, we'll see how that was, big mushroom. Okay, it's going to do the job, right? So, with that being said, is that, as I said in one show, or talked about, maybe I had a conversation with somebody. We was talking about, being specific, gene specific, germ specific. Is there technology where you can have something gene and germ specific that is towards one ethnicity? Because again, the history here of AMA and all that so forth is a study of whose anatomy. As a matter of fact, you ever read the book Henrietta Lacks and what they've done with her and what kind of research they've done and how they use this 23andMe and, and that thing about now that they're going to do this swab test again for the vaccine and what they get to do with them genetics of that swab test. I mean, they got it. You get what I'm saying? And with that information, are you able to create a germ specific, designer specific weapon that could be utilized. That, again, when you go back and read about the Geneva Convention, and when Germany was using that gas and tearing everybody ass up, they had to say, nah, man, that shit ain't fair. But it was because they didn't want us, the destruction of what bombs and stuff do to the property. Then they sued other country for, to rebuild our shit. So it would be better just to get something specific to the people and not have to, with the property damage. So now biological weapons seem to be the food on the menu, or the choice on the menu. Now somebody says, oh, you're going to say nobody's going to, we told you this is not the great equalizer. The COVID-19 doesn't discriminate. Look, it's all kind of, okay. But if that was the case, why was everybody so rushed, gun-ho to throw our face on there? And they was mixing the fact that, okay, somebody being tested as, a positive and death. And let's say, okay, you said that this person, they'll say this city here had 82 or 86 total deaths, and 61 of that 80 something was, say, black people. Then you said 72%. So you're 72% of 86. Why didn't you say that? But you just threw the number 72 out there, and then somebody, oh my God, 72% of black people. You understand? Not knowing the specifics of it. And I'm not downplaying that 61 people died. I'm not downplaying it. I'm saying the propaganda and the empowerment of the mind. And then you can go to other states and look at the numbers and the percentages and see that somebody else got grander numbers, but they was never going to report them. You get what I'm saying? So it seems to me this got the same old scent of something seems familiar. Right? It got the scent of something that smells familiar. That's why it's always looming. And then wonder why nobody don't trust you. Then 97, you sit there talking about somebody in forgiveness. You want somebody always to forgive you. There ain't gonna be no damn forgiveness. There ain't gonna be no forgiveness. You doing it with intent. We have to get in our hearts and minds. When we start seeing this stuff and this shit is falling out, what it is, there is no forgiveness. You gonna carry it all the way to wherever the hell that place may be. There is no more forgiveness. That has been ran out. And they look with you with such a straight ass face as if like, there ain't nothing wrong here. We ain't doing anything wrong. It's a figment of your imagination. Yeah, have somebody sitting there studying them like they some animals. Let them die at that too. Then what did you do with the body? Because you gave them the insurance so that you could bury them, so which means you probably dug them up, and then you understand? We're talking about Frankenstein here, right? I know some of y'all minds can't go there. But what else you gonna call this? This, it was just an accident. At whose expense? Just like you have to come with this so-called vaccine. Who won't be the test monkeys for that? Did I use the word monkeys? Right? Apologies ain't gonna do it. Apologies for slavery. Apologies for Jim Crow. Apologies for redlining. Apologies for disenfranchisement. What? There's got to be some compensations. There's got to be some equalizing here. And so, guess what, y'all? Creator must have to show him face pretty soon. Huh? Because see, somebody got a future with you not in it, but you just don't see it yet. And a lot of our young ones, they, I get it. Nothing wrong with that. Keep that enthusiasm. Keep that vigor and that youth. Nothing wrong with that. I'm never going to hold that against you. But let me show you something as we're going to end out here, because I had a lot more to say, but I ain't nothing else to say. It's all shown right there. Tied in with the Tuskegee, tied in what we originally talked to, and what do it have an old scent, like something that's something not new, but something of old. Got that old scent to it, don't it? Smell like something you're familiar with. And if you didn't know, there it was for you, so you can see. So let me see something here. Let me see if I can pull this up. Let me show you what they thinking about if they're going to be you in the future. Right? Let me see. You can find that yet, sir? You can find that yet, sir? Come on, sir. You should have been that by now, right? Why that at? Come on. Ain't that yet? Come on. No, we don't got that no more? No? It gotta be here, man. I know that ain't gone. I don't see it though, huh? Oh, there we go. We got it. So let's go ahead. Let's show everybody what we're gonna show. We're gonna ride out on that. I want y'all to see this. If you should happen to be BADOS or any person of color, that's what they saying here. Do you really see yourself there? Matter of fact, anytime you watch sci-fi movies, do you see anybody but a quota? Right? So there ain't gonna be too many of you. One is good enough. But check this out. I'll be right back.
Throughout the annals of science fiction, future cities are typically dystopias. Think of the bleak lives of city dwellers in Blade Runner, Metropolis, or the Caves of Steel. Recent projections show that by 2050, 2/3 of the global population will live in cities, which makes it imperative that our future cities aren't vast urban hellscapes, but are instead smart urban centers with a dash of sci-fi. Devices, roads, and lampposts all talking to each other, making life in cities safer and smoother. And this transformation is already beginning. A smart city is a place where items around town are connected. Streets, buildings, personal devices, cars, power grids, all sending data back and forth, passively working together to improve the community. Imagine public buses that trigger sensors in the roads, providing a real-time ETA. Streetlights that dim or brighten depending on foot traffic. Stoplights warning of an accident ahead. At the core, a smart city needs two things: sensors to collect data, and the connectivity to send and receive it. Some cities were early on the connectivity part, like Barcelona, which has had fiber optic cables embedded below its streets for more than 30 years. Other regions, like in the US, have been slower on network infrastructure, but they're catching up. Meanwhile, sensors have become smaller, cheaper, and more powerful, giving rise to the Internet of Things. It's no wonder that the number of connected devices jumped to 8.4 billion in 2017, an increase of 1/3 in a single year. With these two major technological pieces in place, spots around the globe are launching large-scale smart city projects. In Barcelona, sensor-embedded parking spots connect with an app that directs drivers to available spaces. Street lamps brighten automatically, and they're part of Barcelona's Wi-Fi network, providing free internet access across the city. Similar smart city projects are underway in cities like Stockholm, Amsterdam, Copenhagen, and Columbus, Ohio. Some focusing on energy usage, others on safety or public transportation, but all hoping to make life in cities that much better. The hardware and connectivity are here, but truly smart cities need systems talking to each other. And that's not always the case with so many disparate projects. Firms like Ford and Qualcomm are working on languages to connect these systems. Meanwhile, industry experts are already pointing to ethical concerns. A smart city necessarily requires tons of data to be collected and stored, which comes at a high cost, both financially and for citizens' privacy.
All right, y'all. So I want to thank each and every one of you for clicking on the video. All right. Future. Do you see you being there? Smart city, everything collective data to make sure that those urban cities are not like they are now. Be a place where there won't be no Negroes, no BADOS. You can see yourself there. It's kind of like saying when I did the one time the story about Elon Musk taking them to Mars. You want to be the only niggas in Mars with everybody else. You'll be my guest. So again, when you see your brother, greet your brother. What's good, brother? What's good, brother? See your sister? What's good, sister? What's good, brother? If you can't do that much, at least give the universal nod. You know how we do, right? Again, you're going to have some of us who got allies. And ain't nothing wrong with having some allies, but you're going to have to ask your allies some questions. One, ask your allies if they ever heard of John Brown. Ask them, is John Brown real or John Brown some fictional character they made up? Because how come in this country we ain't never heard of a movie John Brown? And John Brown was the worst white man ever born that would take his own son to go out and trying to get the justice for black folks. Too bad your wife, so when shit get hot, it's already hot. They ain't already done jumped out the kitchen. You understand what I'm saying? So again, this has been Black Minds News. I want to thank each and every one of you for clicking on the video. Again, subscribe, comment, share, like, dislike. We got EOC over here. We don't discriminate on nothing. Give me your interpretation of some of the stuff I show. I just show it to you a little bit. We ain't in here to be too deep on it, but we just gonna do what we do.